Hello, I'm Safwan Suhairi. Today I'm going to present an overview on audio and signal, speech and language processing for COVID-19. The introduction is that in this paper, it summarizes the speech signal processing attempts in the fight against COVID-19. This paper also provides an overview of non-speech modalities contribution to audio and speech analysis, which may serve as inspiration. Okay, okay. Uh, from what we can see is an overview of the speech-based application for COVID-19. So it will be used in stress detection, breathing rate detection, cough detection, mask monitoring, sleep quality detection, and chatbot development. The different application using audio processing for screening and diagnosis of COVID. The first one is cough detection. So we have an application named COVID. It is used to detect COVID-19 cough from other cough categories such as normal cold and seasonal allergies. The next one we have Breathe for Sign. It is a web-based portal to where the participant will receive a callback where they have to cough 3 times. So to continue, for the next cough detection application is that we have Cough Against COVID. It is used for COVID-19 cough sample collection. And we also have AI for COVID-19. It is a smartphone app that are ready with COVID-19 cough identifier features. For breathing analysis, diagnosis, and monitoring screening, we have Earthworks microphone M23. It measures the changes of breathing signal in the cross-sectional area of the ribcage and abdomen. Next, we have piezoelectric respiratory belts. It is used to capture breathing patterns. For the next breathing analysis, screening and diagnosis, we have automatic disease classification application. It is a smartphone application that can detect low sound in performing spirometry tests. Spirometry is a test to diagnose lung condition by measuring how much air you can breathe out in one forced breath. The third application for screening and diagnosis is Clara. It's called chatbots. Chatbots named Clara. Clara is developed by Microsoft and used to user speech recognition for initial screening of COVID-19 patients by asking them questions and capturing the responses. And next we have Siri and Alexa. Those are for Apple and Android products. It is updated with answering COVID-19 screening question based on CDC guidelines. CDC is the Center for Disease Control and Prevention. So for the next chatbot application is called Symptoma. Symptoma is a web-based chatbot that can identify COVID-19 from other diseases having similar symptoms with an accuracy of 96.32%. For the fourth screening and diagnosis application is the chest X-ray. Mobile X-ray machines. It is useful as a standard method for the rapid diagnosis of COVID-19 to optimize the management of patients. It is mostly used in hospital. So for monitoring tools developed for the COVID-19 scenario part, first we have face mask detection from voice. In mask detection sub-challenge, the developer tried to recognize whether the speaker was recorded while wearing a facial mask or not. It is useful to develop a voice monitoring tool which detects the mask or no mask of a speaker. A cough and breathing analysis. It is called FluSense. The tool's name FluSense. It is developed by the FluSense platform. It is used to detect influenza-like illness from hospital waiting areas using cough sounds. Third one is mental health emotion detection. We have elderly emotion detection sub-challenge. So the speech capture from elderly people has to be classified into low, medium, and high classes of valence and arousal. Valence and arousal is an emotion detection. So the result from this challenge is that they found out that age groups such as above 60 years are more prone to the infection of COVID-19. For the fourth monitoring tools, we have face mask detection from image. We call that mask-based detection dataset (MFDD). It is used for the detection of mask and unmasked base to keep a check on people wearing masks or not at public places using image processing techniques. So they continue from the face mask detection from image. We have face mask detection system. It is an Apple Store application developed by Leeway Hearts. It can be integrated with the existing setup of an Internet Protocol IP camera for getting alerts on detecting no mask on your face. This is mostly used for public places. So for the last monitoring tools, we have text analysis. We have 5G coronavirus hashtag. It is quite viral in Twitter, and they try to understand the drivers of the 5G COVID-19 conspiracy theory and strategies to help in reducing the spread of misinformation circulating in society. So from that, we get awareness from this paper is that CDC has been encouraging recovered people to donate their plasma for development of blood-related therapies. Second one is that Microsoft has developed the chatbot which interacts with recovered individuals. What what are they going to do with the chatbot is that to gather the required information such as the duration for which they are tested negative, their age and weight. So the challenges in deploying application for COVID-19 is that first, the challenge is getting the relevant and accurate speech data for developing machine learning models. The next one is the design of chatbot also should be well thought of for using them. Why we need to design the chatbot well is because to avoid some drawback associated with using chatbot for sharing the latest information, encouraging desired help impacting behavior, and reducing the psychological damage caused by fear and isolation. So the conclusion that we can be conclude from this paper is that most of the speech-based research works for screening and monitoring of COVID-19 are ready to be customized. And as most of the first level symptoms are related to the respiratory system, continuous monitoring of the patients using audio signal processing based technique can assist the clinician or healthcare providers in providing services while following social distancing norms. That's all. Thank you.